Hi, my name is Dr. Rob Ward. I want to welcome you to another video lecture in the video series at the redox.com. This lecture is about cancer, and it's a very sensitive, very fear-provoking and mysterious topic. And yet, because there is some wonderful foundational research being done on ways to prevent and deal with cancer, I felt it was really important that we talk about it. So there are some really kind of dismal realities about cancer, especially in industrialized countries like America. The truth is that the incidence of cancer has not changed. The incidence in certain regions of America have changed, but if you take America as a whole, the occurrence or the frequency of cancer today of all kinds has really not changed. We have, with traditional treatment, people are living longer with cancer. Their 5-year survival, for example, statistically we've had improvements in many areas, but there really aren't better cures overall, taking all cancers together. Some cancers, like lung cancer, are very, very deadly. Colon cancer, if it's caught very early, is quite treatable, but if it is picked up in an advanced stage, it's very deadly. So some of the leading cancers that are lethal are lung cancer, colon cancer, breast cancer, and that hasn't changed in my entire career of nearly 40 years. Well, why is this? What's going on here? What's at play? Well, the truth is there are two major forces at play. The first is our genetic potential, and it's either we're improving our possibilities of preventing cancer, or we're making it worse. We're all blessed with a certain genetic potential, and whether we express those genes or not depends on our choices. And so we are finding that people are choosing more and more to watch their weight, to eat foods that express these genes that protect us. And if in our video series on how cells work and our genetic potential, I go into this in more depth. So you may want to watch that video. The other option that's at play with cancer is our environmental risks. And these can be very powerful, very powerful. Exposure to certain chemicals and toxins in our environment, like benzene, very carcinogenic chemical. If we're around benzene all the time, it's just a matter of time, you're going to have cancer. Certain foods are more carcinogenic. Foods that have a lot of hydrocarbons can be exposing us to environmental risk factors. Having extra body weight is a risk for cancer. So lean is good, and we're not doing so good in America with regard to our body weight. It's going up, and so it's affected the statistics adversely. Well, traditional treatment, as some of you may know, involves chemical therapy, chemotherapies, radiation, surgery is important. There are new biological therapies that are targeting certain chemical markers that have promise, and stem cell therapy, which has really been largely a big failure. Because when we start messing with our genetics at a very deep level and forcing the body to do certain things, it kicks up and says, nope, that looks scary to me, I'm not going there. And it fights back, and so that has not been a very helpful thing. Well, for me personally, I've been asking a question since I went to medical school. And why is there not much focus or talk about primary prevention? I mean, preventing cancer in the first place. It's one thing to detect it early, and that's where you hear so much work being done. But detecting early may or may not really be that good. What if we could just prevent it in the first place? That's where my heart has always been. And so since the late 1970s, my thoughts and ideas have been oriented toward that. And I've tried to look for things in healthcare that are focused that way. My family tree is littered with cancer, and so it's kind of a personal topic for me. So let's talk about 3 studies and some of the things that pertain to redox biology, the health of our cells, our redox potential. So cancer is actually a redox disease. It involves mitochondrial dysfunction. Cancer cells don't run right. Their cells, they don't work right, and they don't work like a healthy cell. Cancer cells crave glucose. They want to get their energy from breaking down a 6-carbon molecule into a 3-carbon molecule. It's called glycolysis. Most cells would rather not do that. They'd rather have aerobic metabolism. So this was discovered years ago. It's called the Wahlberg effect. And in fact, when people are interested in whether or not their cancer is getting better or worse or what, they'll oftentimes have a PET scan, PET scan. And what it does is it takes into effect this glucose craving that cancer cells have, and it uses a radioactive analog of glucose. And where it's taken up by the cancer cells, it lights up. So your scan is positive where there's a lot of glucose being craved by certain cells. So one of the theories that is coming back into popularity is not to focus on the immunosusceptibility, the immune system weakness of our biology, but really to get back to a more basic of, hey, what if we could really block glycolysis and make it a very hostile place in our body for cancer to even start a few cells. So a lot of research is going into this area. It's very fascinating. And so one of the things that I know is true is that when we have a cellular balance where there is an absence of oxidative stress, we make it very hard for cancer cells to get started. Okay? And so it's not whether you eat sugar. That's not it. It's these cancer cells that want to crave sugar. That's the way of their metabolism. And it creates, it happens where there's mitochondrial dysfunction and cells start to break down from oxidative stress. Okay. Another study that I found that was very interesting from 2013 looked at prostate cancer and breast cancer. And they noticed that the cells in a prostate that had cancer, the cancer cells, where there was an area of a tumor in a prostate gland, they had a progression due to redox imbalance. In other words, the degree of oxidative stress was equal to the aggressiveness of the cancer cell behavior. The more aggressive the cancer was cellularly, the more redox imbalance there was. In breast cancer, redox imbalances were discovered to regulate gene expressions and alter protein stability. And so this is partly believed to be why oftentimes there is resistance to the chemotherapy that's being applied to kill cancer cells, and it's related to redox imbalance. And so what if we could alter redox chemistry here and improve the capacity of chemotherapy drugs to work? Fascinating area of research. A lot is happening here. Another interesting study I ran across also focused really on looking at the etiology of cancer. And without a doubt, cancer is related to oxidative stress. And so it's this crazy world of reactive oxygen species, too many oxidants, versus our ability to fight back and have defenses in place with antioxidant efficiencies. And so in this particular study, they demonstrated at a cellular level that phytochemicals, like nutrients, like green foods and all these things that we know help upregulate the production of transcription factor and that upregulates the expression of our adaptogenic DNA, that these are chemoprotective and they have great potential to stop the actual incidence of cancer, to stop carcinogenesis. So it's fascinating. We now today have the ability to supplement our body with stabilized redox molecules and literally provide a bath of these molecules at a cellular level. They are stabilized and provide resources to cells. And so if oxidative stress is the etiology of cancer at a cellular level. And it's more about maintaining cellular balance than it is about having the genetic expression. I think that this may represent a real key component in helping our bodies stay in balance as we live and age. We may veer off course, but if we can provide ourselves with good redox resources in the way of supplementing with redox molecules each and every day, not just when we feel tired or something, to provide ourselves with vital nutrients that we know have the ability to increase the production of our antioxidants, increase the efficiency of those antioxidants to maintain a proper redox balance, and then to just do our best to keep clean and away from toxic exposures. I think if we do that, we may see a change at a primary level in preventing cancer. And this is not to say that supplementing redox molecules is some kind of panacea, but I know it's a key factor, and that is part of why I make sure that I supplement my body each and every day. So I hope that's been helpful. It's a tough topic to talk about. It's a very broad topic, and it's difficult to kind of put it into just a 10-minute presentation. But there's a lot of promising research at a therapeutic level and a preventive level that I think that we all should be aware of. Thanks for your attention. See you at the next class.